this is busy just to show you that there are different levels of us. We come in all kinds of colors and sizes. You can use your MA to do something. If you have an MA in your office that has an interest, and many of you may have an MA that has diabetes, and your patients get sent to that person, but you want to make sure that the person that's teaching has the right knowledge. Wrong knowledge provided is going to be very difficult to correct. So there's a role for your MA, there's a role for the neighbor that has diabetes, there's a role for a mother of a child with diabetes that wants to share to other parents. So there's a role for what we call the level 1. Then there's a role for if you have a nurse, or you have a dietitian, or you have a pharmacist. There are pharmacists at the Walgreens and at the CVS that could help you if you don't have access to anybody else. They know something. Now you can use a diabetes educator, and I told you what diabetes educators are. I'm a nurse, but I decided that this is what I wanted to do, and I have trained to do this. I do this 100% of my time. So I do it a lot, and I know how to do it. So that's a diabetes educator. I've got ahead and got credentialed. So I am a certified diabetes educator. Now we have nurse practitioners, physicians, PAs, or diabetes educators that have prescriptive authority, and we have some here. You're a level 5. You're really taking care of your patient in the bigger sense of the word. You're doing lipids, you're doing all other kinds of things. So this is just to show you that there's a role in the spectrum of people that we work with that can help you provide this care. And you can find this in diabeteseducator.org, or you can ask me later if you want more information. Now, we've already talked about some of these things. What do you do if you are bombarded with patients with diabetes in your practice? Different things. You can, if you have high volume, you can do diabetes days. What were you saying? Group visits. Group visits is the new thing. I'm going to talk a little bit about it. So diabetes days, we heard some people pick a day and they bring all the diabetes patients on that day. You're prepared to make sure that you're following all the standards of care. You have your vaccines, your referrals, everybody's taking their shoes off. It makes it easy because you're following the same routine. Group education, it works very well. Shared medical appointments or group medical visits, the buzzword, a lot of people doing them. We're going to talk more about it. You need to identify who's your provider of diabetes education. And I'm going to keep telling you this. And it can be anyone you pick, but that person needs to be trained, and you need to decide what that person can do based on their level of training. And then please look into reimbursement and coding. You could code more complex visits if you're doing group visits. If you're providing diabetes education, you work with a recognized program, you could work with the educator on billing for diabetes education. So real quick, this is my model. I'm at Emory University. I do multicultural diabetes education in Spanish and in English, and I have different models. I get called from a clinic because they have all these Spanish-speaking patients, for example. I go find out what they have. And based on the resources they have, we train them. So I work with a shared medical appointment model where we have physicians, diabetes educators. I call DINA's peer support, and we have a clinic contact. Site coordinator, I took my program from Georgia to Alabama. I have hired a site coordinator. I work with doctors, with PAs. We have outreach workers, and there's a van driver that we train because this person is part of the clinic, and that person takes patients in the van for 30 minutes. What a best time to talk to them about something that's not the weather, but talk to them about diabetes. So this guy's coming to my training. His name is Neftali, and I love talking about him. Instructor model. People that speak Spanish that know me and are interested in doing classes in Spanish have come to me, and I have an instructor group, and we meet once a year, and I train them on doing my program. So when I get asked, Gainesville, Georgia, I need a program in Gainesville, Georgia. Okay, I have these people that could teach your program. You hire them, and they can come. They don't have to pay me anything, but I have trained somebody that can do the program. And this is when I started the program, and it was only me. I was the one going around teaching it everywhere. I still do that. So based on the resources, you can develop a model. This will be real quick what your MA could do. So your patient walks in. You want to make sure that patients with diabetes recognize foods that raise blood glucose. Do we agree with that? Your MA could ask, so tell me, what are the foods that raise what foods that are starch, milk, or fruit do you eat? How many portions are you eating? then they can teach the patient how to use a play method. You know what the play method is? Perfect. Wouldn't that be simple? Your MA could do that. And then, your MA could ask the patient, so give me some examples of foods that you eat that will raise your blood sugar. How long do you think that will take? 3 minutes. While they're walking the patient to be weighed and take them into the room. That's probably the person that spends the most time with your patient. So just to give you an example. Level 2 will be working, like I said, with an RN, an RD, or a pharmacist. Level 3 or 4 is working with a diabetes educator. If you don't know where a diabetes educator is, there's a website, diabeteseducator.org. There's a big button called Find a Diabetes Educator. You go to your state. It gives you a full list with phone numbers of everyone that's there. Establish a referral process and meet this person. Okay? So, does your practice currently implement group visits? Let's answer 1 for yes, 2 for no. Ooh, half. Goodness, I don't need to talk about this. You all will be teaching me. So I am doing group medical visits. I'd love to hear from you. We're going to have a breakout session where we're going to talk about that. We can talk about that. Issues to consider. We're talking about diabetes here, so this is what I'm going to tell you. You can do group medical visits with diabetes. Invite your patients. You decide how frequently are your visits, and you do problems identified out of those visits. You bring your patient back for the appointment. You're not taking care of everything at that visit. That's how we're doing them. You know, you can create your own model. If you're thinking about starting them, you could use a yearly annual visit for diabetes for your patients that are in control, or more frequent visits for your patients that are out of control. 2 hour, 10 patients is the most we've been able to do. I don't know if anybody has more experience. That's about right. Yeah, we tried 15, we went crazy. You gotta plan like you're in Hollywood, and it's gotta be very, very scripted and planned. You're gonna have all kinds of emergencies. Individualized flow sheets work, education materials, and make sure you work with your billing department to see how you can code this differently. What are the benefits? Greater access, a more holistic approach. I really did not see increased time with the MD, but decrease wait time. Rather than waiting for an hour and a half to see the doctor for 10 minutes and the MA for 15, the entire time is used in productive learning or caring time. And a lot of attention to psychosocial issues. It is voluntary. If your patient doesn't want to join, they don't have to. It's very interactive. It's very efficient. It's team-based. It's fun. And patients love it. Diabetes education is an integral part of diabetes care. They have to be part of it. Your patient will not be able to follow if they don't understand how to do it. And providing access to diabetes education to your patients will optimize their diabetes control